In this video, we're going to begin entering information about your community. If you don't have specific numbers, that's okay. The model contains average numbers for all First Nations in Ontario. If you don't have information about your community, but you would like to, Chiefs of Ontario can facilitate access to community datasheets held at ICES. You may contact Cal Stewart at Chiefs of Ontario for requests. Please have either a letter from Chiefs and Council or a Council resolution before you make the request. However, the data sheets are not required to use the model. This is because the model can tell you relative impact of changes you make opposed to actual numbers. The information you enter into the model is not saved or stored anywhere. So first you have the option to enter your community's population size. Don't worry if you don't have exact population, as long as you have an estimate. Next is the percent of households with 2 or more people per room. This is going to tell the model something about contact rates between people, as well as an individual's ability to self-isolate if they have a case of COVID-19. Here, you can also adjust age distribution. So this is already set to the averages for all First Nations in Ontario, and you may adjust if, for example, you know there are more elders in your community, or if you know there are more youth. Make sure the numbers add up to 100%. You can see here we have an age distribution chart, and just ensure that if you do make any changes to age distribution, that the total still equals 100%. Level of travel between your First Nations community and other First Nations communities. This is a sort of measure of high versus low connectivity between First Nations communities. And finally, what is the nearest public health unit? This, combined with level of travel, gives the model an idea of how close your community is to a health unit with high or low infection rates, and how likely the chances are that an infected individual may travel into your community. In the next video, we're going to learn how to enter information about efforts to protect against COVID-19 as of today.